So hi everyone. It's such a pleasure to be here. My name is Christina. I'm really excited today to talk about a topic that's very important to me that I think that will be very important to everyone else in this room. So today I'll be talking about emotional intelligence, including what it is and how to enhance it. So I'm here as a speaker with Well Intel Talks. And so Well Intel is a wellness education company that provides evidence-based corporate talks on various wellness topics like mental health, motivation, and of course, emotional intelligence. So before getting started, I just want to share a little bit more about my background. As Carissa mentioned, I received my master's degree in clinical psychology, and I'm currently in my final year of my PhD. And right now I have a few different roles. So first, I work as a psychology resident within the Fraser Health Authority. So I provide assessments and therapy to people with complex mental health challenges in a hospital and a community setting. I'm also a researcher, so my research focuses on understanding why some people engage in high-risk behaviors and also experience emotion dysregulation. And then finally, I'm an educator. So I've taught a psychology course at the University of Victoria, and I also provide mental health talks and workshops to different organizations with a focus on emotional regulation and emotional intelligence. So as a quick disclaimer, even though I am in psychology, this presentation doesn't constitute mental health intervention or advice. So it's not a substitute for psychological or medical services. This presentation is only for informational purposes, but that said, I'm going to try and provide all of you with actionable information that you can apply to your life if you would like to. So the overall goal of my talk today is to help cultivate the emotional intelligence of everyone in this room. And to do that, I'm going to take you all through 3 key topics and learning objectives. First, we're going to discuss what emotional intelligence is and why it's important. Second, we'll talk about how to regulate and respond effectively to our own emotions. And then finally, we'll discuss how to effectively respond to other people's emotions, particularly in a healthcare setting. So I'm going to aim to talk for about 50 or so minutes, and then I've included some opportunities to participate throughout. If you would like to share something, please put it in the chat and I'll do my best to respond. And then we can also chat at the end as well if there's any feedback or reflections. Just going to try and put my chat open here so I can keep up with everyone if people put ideas. Okay. So to set the stage, I'd like to ask you all a question that I'm hoping people can share. And the question is, who has ever experienced difficulties because someone else was unable to regulate their own emotions? So for anyone who feels comfortable sharing, maybe put like a yes, no, or unsure in the chat. Okay, I'm seeing lots of yeses. Yep, someone has a toddler, so every day. Okay, yeah. So as expected, a lot of us, probably most of us have had this experience. I know I definitely have. In my own life, there are times when I interact with someone who's very emotionally dysregulated, whether it's a friend, family member, or colleague who is going through something really intense. And it can be really challenging when this happens because not only can it strain my relationship with that person, but it can also make me lead or feel stressed out or even burnt out. And I've noticed that when other people can't regulate their emotions, it can be hard to keep my own emotions in check and communicate effectively. So the thing to keep in mind here is that emotion regulation difficulties are something that pretty much everyone experiences at some point in their life. It's a really common human experience and no one is fully immune to it. And so that's why we're here. One of the first reasons is that we're going to learn some practical strategies that can help us to regulate our own emotions and also to support other people so we run into these problems less often. Okay, I have another question for all of you. Once again, please feel free to put your ideas in the chat. This time the question is, have you ever had problems because someone else could not understand your emotions? Okay, once again, seeing lots of yeses, and it looks like most of us have felt this way too. It can be very frustrating when someone else doesn't understand what we're going through. So, for example, if you think about a time when you were feeling really stressed out or anxious, and the person that you were talking to didn't seem to understand, or maybe they even dismissed your feelings entirely, it can make you feel isolated or even more dysregulated than before. But on the flip side, when someone does understand us, when they really get what we're feeling, it can be really powerful. We feel heard, valued, connected to that person. And so that's the second reason why we're here today. So, in addition to learning how to manage our own emotions, we're going to talk about strategies to better understand the emotions of other people. So, now that we've set the stage, let's dive into what emotional intelligence actually is, because it's quite a buzzword. When we talk about emotional intelligence, there are actually two main abilities that make up that skill. First, emotional intelligence involves the ability to be aware of and manage our own emotions. So, awareness means recognizing and identifying what we're feeling at any given moment. And then regulation means having the ability to influence our emotions. So, choosing which emotions we experience, understanding when emotions arise, and controlling how we express them. Second, emotional intelligence involves being aware of and responding to the emotions of other people. So, this means recognizing and understanding what someone else is feeling, even if they don't say it directly. It also includes using social skills to help others manage their emotions, whether it's comforting a colleague or de escalating a tense situation. The important thing to know here is that emotional intelligence is a skill that can be improved with practice and effort. And so we are all capable of increasing and improving our emotional intelligence. So, why should we even care about emotional intelligence, especially in a healthcare setting? It turns out that emotional intelligence isn't just a nice to have, it's actually one of the strongest predictors of a wide range of positive outcomes that are really critical in our field. So, for example, research shows that people with high emotional intelligence tend to have better mental health and resilience to stress, which is important when facing the daily challenges of healthcare work. It's also associated with a deeper self understanding, like knowing your own needs, values, and priorities. And this self awareness is important to being effective in our personal lives and at work. It's also linked to greater productivity, stronger social relationships, more cohesive and supportive teams where colleagues trust each other and work together smoothly, higher creativity and problem solving, and importantly, reduced risk of burnout. And in fact, emotional intelligence is one of the most consistent predictors of mental health across a wide variety of different mental health concerns and symptoms. So, as we can see, emotional intelligence has clear implications for our lives. And so, it's worthwhile to take steps to improve these skills because they help us to get our own needs met as well as support the people around us. So, the next big question is, how do we actually improve our emotional intelligence? There are lots of different strategies that you can use, and today I'll only cover a few of the key strategies. But one thing to keep in mind is that different strategies work for different people. So, what works for you might not work for someone else. And so, for this reason, it's really important to try out a bunch of different strategies and then focus on developing the ones that seem to work for you. So, it's really about quality over quantity. So we know that emotional intelligence is important and has a lot of benefits. So why aren't we emotionally intelligent all the time? Why do we all seem to have moments when it's hard to regulate our emotions? It's because there are many things that can get in the way of being emotionally intelligent. So for me, I know it's definitely a lack of sleep. So when I'm super tired, haven't slept well, I'm way more likely to have negative emotions and then struggle to regulate them. I'm wondering what are some other ideas? What are some other ways, or sorry, what are some other barriers to being emotionally intelligent or things that get in your way? Maybe add some ideas in the chat. So irregular eating. I see a lot of people actually saying hunger. Yeah. Just general levels of high stress, trauma, inactivity, overstimulation, lack of self care. Yeah. Those are all really, really great points. And so we can see some common themes, but we can also see that it's slightly different from person to person. So it's really important to know, like for you, what tends to get in your way. That's a really important thing to kind of reflect on. But I'll talk a little bit about what the research shows actually gets in the way of regulating our emotions. So first, there is biology. Some people are just naturally more emotionally sensitive than other people. And this difference actually shows up even in babies. So sensitive individuals might find themselves getting upset by things that might not like bother other people. Other people might not even think twice about. Their emotions might be more intense, making it harder to learn and use emotion regulation strategies. And while this emotional sensitivity can actually bring strengths and be a positive thing, it can also sometimes pose challenges for managing emotions. A second problem that can get in people's way is having a lack of emotion regulation skills. So some people just simply haven't learned how to regulate or change their emotions effectively. They might not know what steps to take or what to do to manage intense emotions, and so it makes it hard to do so when big life stresses happen. And the third thing that can get in the way is emotional overload. And this kind of goes hand in hand with what a few of you have said in the chat about, several problems are all piling up. You just have really high stress. And so sometimes in life, emotions can just be so intense that we reach what we call a skills breakdown point. This is basically when your emotions are just so overwhelming that even if you do have emotion regulation skills, you can't really access them in that moment. So you might know what to do in theory, but the intense emotion makes a mental block and it's hard to actually apply those in practice. So as we go through the rest of this presentation, I encourage each of you to reflect on which of these factors might be your biggest barrier, because being aware of our own barriers can help us to identify the most effective strategies to improve our emotional intelligence, which we'll talk about next. And so that brings us to our first emotion regulation strategy, which is to reduce our vulnerability factors. This is especially important for those of us who have a biological vulnerability to being emotionally sensitive. And there are several different ways that we can reduce our vulnerability, and I'll cover a few of the ones that are based on the latest research. So first, it's really important to try and engage in at least one activity per day that brings you a sense of pleasure and mastery. So pleasurable activities are those that make you feel happy, satisfied, or calm. So for example, this could mean watching your favorite TV show, cooking a delicious meal, or taking a walk at sunset. In contrast, activities that build a sense of mastery are slightly challenging and push you out of your comfort zone. And so these activities make you feel accomplished and boost your sense of self-efficacy. So for me, I get a sense of mastery through exercise. The specific activities that work for you are going to depend on your preferences and your values, but it's important to try and balance both pleasure and mastery in your routine. Second, you can reduce your emotional vulnerability by taking care of your body. So our physical health has a really significant impact on our emotional resilience. So for example, getting adequate sleep is super important. Most people need about 7 to 9 hours per night, and consistency has been shown to be important. So trying to go to bed and wake up at the same time each day, even on the weekends. Regular exercise is also powerful. So research shows that even just 10 minutes of moderate exercise can have an antidepressant effect. So it doesn't have to be really intense exercise, but even just a brisk walk can be effective. Eating a consistent, balanced diet is another factor. So some foods make us feel sluggish and down, while other foods tend to make us more energized and boost our mood. And so finding the right balance will be a personal journey of trial and error, but it's definitely worth it to reduce your vulnerability. And finally, it's really important to treat any physical illness or pain that you're experiencing. So when we're physically unwell, we're more emotionally vulnerable. Minor stressors can feel much bigger and our body is under strain. So one thing I want to point out here is that there are inevitably going to be times in our lives when our emotional vulnerability is high. This is part of being a human. And so what we say is that during these times, it's wise, if you can, to just try and avoid those really high stakes emotional situations until our vulnerability decreases. Or we can try and take proactive steps like the ones I've outlined on this slide to try and reduce our vulnerability before we respond. The reason this is so important is that these small actions basically help to set the foundation of emotion regulation skills. So, what do we do with this information? First, it's really important to remember that emotional intelligence can be improved over time with practice and effort. And second, identify what gets in your way of being emotionally intelligent, and then try and address those vulnerability factors as much as possible. So, the next strategy to regulate our emotions is to recognize, understand, and appreciate why our emotions are there in the first place. I'm sure many of us have had thoughts like, things would be so much easier if I just felt nothing, or I just want to stop feeling this way. When we push away our emotions, although it might feel good in the moment, it actually makes them more intense and stick around for longer. And then they can start to bubble up and over into other areas of our life. So, one of the best things that we can do is try to understand and accept our emotions. So I have a question for everyone, for those who feel comfortable sharing in the chat. But I'm wondering to hear from everyone, why do you think we even have emotions? What do emotions give us? What good are the emotions? Any ideas? Keep us safe, help with survival. It would be boring without emotions. Yeah. A way to communicate. Yep. Okay, so a lot of people are noticing that this is something that we've evolved as a human species for one reason or another. Seems like it helps us to connect with others or to express ourselves. And that's exactly right. So we've evolved emotions because they are important and help us basically to survive. So the first thing that emotions do is they provide us with a signal that something is happening. This can then motivate and prepare us for action. So, for example, if you said something offensive to someone, then the guilt that you experience might motivate you to apologize. Or if someone attacks you, then the anger or fear that you feel might mobilize you to attack back or run away to protect yourself. Second, emotions communicate to and influence other people. So, for example, if you express anger, it can cause someone to. In contrast, if you express sadness, it can prompt someone else to ask you if you're okay and give you support. So emotions are very powerful communication signals. And finally, emotions communicate to ourselves. So they're basically signals for us to check things out and to pay close attention to our gut instinct. At the same time, it is important to remember, though, that emotions are not facts. So, for example, feeling scared doesn't necessarily mean that you're in danger. Sometimes you might be, but other times it might be a false alarm. So, we basically want to use our emotions to explore and check things out, but we don't want to just blindly follow our emotions and what they tell us to do. So, the key message here is that all of us need emotions. Our goal is not to get rid of emotions. And once we actually recognize and appreciate what our emotions are doing for us, it can be a lot easier to accept them and then in turn to regulate them. The next step here to regulate our emotions is to become aware of our emotions. Why is this important? Well, we can't actually change or manage an emotion if we don't realize it's there. And so this is particularly important when it comes to burnout, which is really common in healthcare professionals. By the time burnout sets in, it's often too late to effectively manage the emotional toll. It's a long process of emotional depletion that could have been prevented with earlier awareness. And so the key here is to catch it before we reach that point. And so awareness helps us to intervene early and make choices that can prevent emotional overwhelm and burnout. So by tuning into our emotions, we basically give ourselves the ability to respond thoughtfully rather than reacting on autopilot, which can lead to emotional exhaustion. So there are three different ways to develop our emotional awareness. The first step is just to observe your emotion. Observing means simply noticing that an emotion is present without judging it as good or bad. It's about stepping back and being a witness to your experience. For example, let's imagine you're caring for an elderly patient who refuses to take their medication. You've been working really long hours, and this resistance is the last thing that you need today. Observing your emotion in this situation might mean just simply noticing that you're having physical reactions like tightness in your chest or shoulders, having kind of a faster heart rate than usual, having thoughts like, I just want them to cooperate. So, observing is simply just noticing that experience without trying to push it away or telling yourself that you shouldn't feel that way. Second, you can describe your emotions. So once you've observed an emotion, the next step here is to try putting a word or a label on it, because labeling emotions can be really powerful. In this situation, you might say something like, I'm feeling frustrated. Or you might even go a few steps underneath that frustration and identify other emotions that might be there. Maybe there's some sadness as you think about how much you care about that patient's well being. Or maybe you're feeling a sense of helplessness because despite your best efforts, the patient isn't cooperating. So, by labeling these emotions, frustration, sadness, helplessness, you're basically creating a little bit of distance from that emotion, which can actually help to reduce its intensity and the duration of that emotion. And finally, you can actually participate in your emotions. So, participating basically means that you're letting yourself fully experience the emotion without pushing it away or letting the emotion control you. So, in this scenario, you might allow yourself to acknowledge and feel the frustration or sadness that you're having without judgment. Take a moment to notice how these emotions naturally rise and fall in your body, kind of like waves in the ocean. By participating, you're basically allowing the emotion to move through you rather than build up inside and eventually spill over into other areas of your life. This doesn't mean letting the frustration dictate your actions, but rather just allowing it to be there so you can respond with calmness and clarity. And just an FYI, sometimes it's not feasible to fully throw yourself into the emotion in a given situation. For example, if you're in the middle of an important patient interaction and you just need to get through it, you may not actually be able to let yourself fully feel that emotion, and that's okay. But what you want to do is to try and carve out some time in your day to let yourself feel those emotions that did come up. For example, taking a quick 5-minute break or reflecting at the end of your day on what emotions you are feeling. Practicing emotional awareness like this basically helps us to prevent the buildup of emotion that then leads to burnout, ensuring that you're able to stay engaged and present with your work instead of feeling drained and detached. So, some people find it helpful to use an emotion wheel when describing their emotions, especially when they're first getting started with this skill. So, at the center of the wheel here are the most basic emotions like sadness, anger, fear. And then as you move outward, the emotions become increasingly complex. So, research has shown that the more descriptive we can be with our emotions, the better able we are to regulate them. So, I'd like us to all try this out. We'll pause here for about a minute or so, and I want each of you to take a minute to reflect on 3 different emotions that you have felt today so far. You could write them down on a notepad or on your computer. You're welcome to share them in the chat, but you don't need to. And then we'll reconvene, yeah, in about a minute or so here. Yeah, some people are saying that the screen's quite fuzzy. I'm sorry about that. I'm not sure if I can change that. Let's see if I make this bigger. Oops. Does that look any better? Okay, great. So yeah, let's do another 10 seconds or so, and then we'll come back here. All right, so I'm wondering for people, I've seen a few of you already putting your ideas into the chat, which is great, but I'm wondering, how did you guys find this activity? Was it easy, pretty medium, or was it hard to think of three emotions that you felt today? Okay, someone said very hard, medium, easy. Okay, I'm seeing quite the split, but quite a few of you found it medium to hard. Okay, so we can all see that we're at different kind of places with this skill. But for some of us, it can actually be really difficult to notice and put labels on our emotions, which is why this actually takes a lot of practice to do. And so practicing this skill is worthwhile because, as I mentioned earlier, we really can't change our emotions until we first are aware of our emotions. So we really need to develop this skill first. Okay, so let's move on to the next skill here. The next way to regulate our emotions is to understand what emotions are and what is actually going on when we have them. So basically, emotions are involuntary, automatic responses that we have to internal or external events. So this means that emotions just happen regardless of if we want them to or not. It's automatic. And emotions can be triggered by something going on inside of us, like the thoughts that we're having, or by something going on outside of us, like an argument with a friend or a coworker. So emotions have different components, and I promise this is the most technical that I'll get today. But this is a model of emotions that was developed from cognitive behavioral therapy, or CBT for short. And this model helps us to understand what the different components of an emotion are. So this means that when we have an emotion, there are actually three separate processes going on in our body. We have the thoughts running through our head, we have the sensations in our bodies, and then we have the behaviors that we carry out. And together, these three processes make up what an emotion is. So let's go through an example to get a better understanding of what this means. So let's imagine that you're out hiking and then you go around the corner and you see a bear. Automatically, what are some thoughts that you might have? Maybe just put some ideas in the chat. What would you be thinking? I'm in danger. I need to get out of here. Oh my God, and freeze. Yep, these are all great ideas. So you might think like, holy crap, oh my gosh, I better run and get out of here. Second, what do you actually do? What is your behavior? What would you do? Keep quiet, freeze, run. Yeah. So this actually depends on the type of bear. So this is also kind of a test of bear safety, but you might turn around, run away, climb a tree, or yell and scream. And then third, what might you be feeling in your body? What are some like physical sensations that you might have? Goosebumps, cold, heart rate increased. Yep, these are all great ideas. Yeah, so your heart rate might increase, your pupils might constrict. Okay, so now that we've kind of brainstormed these different thoughts, behaviors, and body sensations, what emotion do you think we're feeling here? What is the actual emotion? Panic, fear, scared? Yeah, exactly. You all have it. So when you have an emotion, it can be helpful to reflect on what is actually making up that experience. So what are you thinking? What are you feeling in your body? And what is your emotion telling you to do? So now I want to show you guys how changing these three different components can actually change our emotion. So let's imagine now that we see the bear again when we're hiking, but this time we have thoughts like, how cute, oh my gosh, you need to get a photo. I wonder if I can get closer. For our behaviors then, we might walk toward the bear, take photos of the bear, talk at a normal voice volume. And then for our body sensations, we might feel a bit loose and relaxed in our chest. experience a slight increase in our heart rate and breathing, and feel energized in our body. So, what emotion do you think is happening now, given those thoughts, body sensations, and behaviors? What emotion do you guys think this might be? Yep, I already see lots of people have got it right. So it's excitement, right? This time with slightly different thoughts, body sensations, and behaviors, you can see how the emotion actually changes. So the takeaway message here is that if we can change our emotions, or sorry, if we can change our thoughts, body sensations, and behaviors, then we can actually change our emotion. It's kind of like an equation. The thing is that this actually takes a lot of practice because we have to first be aware of what thoughts, behaviors, and sensations we are actually experiencing in the moment. And so, what I'm going to provide next is some different strategies on how we can change our emotions by changing our body sensations, because this is often the easiest place to start. So, the first way that we can do this is with paced breathing. This method directly targets our body sensations and has a really quick and noticeable impact on our nervous system, helping to reduce emotional arousal. So, paced breathing is a really simple and discreet strategy that you can practice anywhere, whether you're on the bus, sitting at your desk, or caring for a patient. It's really subtle but powerful. So, here's how to do it. First, you want to start by inhaling slowly through your nose for about 4 seconds. It's important to breathe deeply, allowing the air to expand your stomach. This type of deep breathing helps to activate your diaphragm rather than shallow chest breathing, which can actually cause more tension. So make sure your shoulders are staying relaxed and flat and that the air is filling up your stomach, not your chest. Second, you want to hold your breath for about 1 second. And then third, you exhale slowly through your mouth or nose for about 5 seconds. The key here is that the exhale should be longer than the inhale because that's the part of the breathing that helps to calm down your nervous system. Fourth, you hold for another second and then you repeat the whole cycle. While you do this, you want to pay full attention to the sensations of breathing. So if you're doing deep breathing, but you're ruminating or worrying about something, it's not going to work. So you want to notice and observe the sensations of your breath coming in and out. Another key way to change our body sensations in order to change our emotion is to use temperature. So, specifically, exposing our faces to very cold water or temperatures is one of the fastest and most effective ways to reduce emotional arousal. So, this strategy is particularly helpful in moments of high distress when we've reached our skills breakdown point. So, remember, this is a state when we're so overwhelmed that we can't access any other emotion regulation strategies. The reason the skill works is that it quickly tips our nervous system, causing a rapid reduction in emotional arousal. And specifically, it activates the dive reflex, which is a natural response that all humans and mammals have. So, when our face is immersed in cold water, this reflex basically causes our heart rate to slow down, helping us to conserve energy in really stressful situations, like if we were submerged underwater. It's basically a survival mechanism that we've developed and that all other mammals have. And so, what makes this skill so effective is that it can help to buy you time. Basically, it allows you to pause, clear your mind, and regain the ability to choose your next step, and then other emotion regulation strategies that you might want to use. So, I recommend using this skill by keeping an ice pack at home or work, and then placing it on your face or your neck when needed. Or alternatively, you could splash your face with cold water or take a really cold shower. And the nice thing about this strategy is that it works within seconds to minutes, so it's quite an immediate benefit. I will have to just caveat this though by saying that this strategy is not recommended for people with cardiac conditions, because actually the sudden change in your heart rate can be so intense that it could pose a risk for those with underlying conditions. So if that's the case for you, just make sure to talk to a doctor first before trying. Okay, so let's recall that model of emotions I showed you earlier. So we just talked about two strategies to change our emotions by changing our body sensations. And it turns out that we can also change our emotions by changing our behaviors. And so we'll talk about some strategies on how to do this next. So first, I'd like us to do a little experiment. So I want everyone to tense up as much as you can. So clench your jaw, squeeze your hands together, bring your shoulders up to your ears and hold it there. And I want you to notice your emotional experience as you're doing this. You might feel tense, heat up, or anxious. And now let's do the opposite. So I want you to drop your shoulders, open your palms up with your hands facing upward, and relax your jaw. And now notice your emotional state now. You might feel a bit calmer, more relaxed, or even lighter. So for those of you who gave this a try, this activity basically demonstrates that there's a powerful two-way link between our emotions and our behaviors. So it shows that not only do our emotions influence how we behave, but our behaviors also influence how we feel. And we can actually use this connection to our advantage to help regulate emotions. In simple terms, if we want to change if we change how we act, then our emotions will change in response. So the key idea is if you want to shift a difficult emotion that you're experiencing, you can intentionally act opposite to that emotion. I know that's maybe a little confusing, so let's kind of go through this in more detail to see what I mean. So as I mentioned at the beginning of the presentation, every emotion basically signals us to take a certain action. We call this an action instinct, and it's hardwired into all humans. So for example, when we hear a loud car horn, our automatic instinct is to startle. So let's test this out with a few other emotions. So when someone is scared, what do you think the emotion tells them to do? Maybe put it in the chat. What would scared or being a fear? Yeah, run, hide. Exactly. So fear basically tells us to avoid. So to act opposite of fear, we would actually want to approach what we're afraid of. For example, if you're scared of being judged by a colleague or a patient, to change that fear, you would actually want to expose yourself to situations where judgment might occur in a controlled way. This could involve taking on a new responsibility at work, like leading a team huddle or initiating a difficult patient conversation. But even small steps like this can help shift the emotion by challenging the fear in a manageable way. So let's try a different emotion. When someone is sad, what do you think the emotion tells them to do? What's the automatic instinct when you're sad? See lots of crying. Yeah. Withdraw, curl up and isolate. Exactly. So sadness basically tells us to withdraw or disengage. So to act opposite of sadness, we need to engage. So for example, if you're feeling down after a tough shift at work, you might choose to engage in an activity that gives you a sense of accomplishment or connection. So this could involve reaching out to a supportive colleague, cooking a nice meal, going on a relaxing walk, or taking a bath. The sinister thing about sadness is that it tells us to withdraw, but then when we withdraw, we actually tend to feel more sad. So if we want to act opposite to that emotion, we need to change basically how we're behaving, and we need to engage. Okay, so to try one more, when someone is angry, what do you think that emotion tells them to do? What's the action instinct for anger? Fight, yell, shout. Yeah. Yeah, so anger typically tells a person to attack or to run away. So acting opposite to anger can be really difficult, but it is possible. So if you're feeling angry with a colleague or a patient, one way to act opposite is to intentionally step back and avoid escalating the situation. So you might take a few deep breaths or choose to engage with a person in a calm, measured way, even if you're feeling tense. Another approach could be to offer to help or show understanding, even when you're feeling angry, which can shift the emotional dynamic. It's really important to know that you should only use this skill of acting opposite to an emotion in two scenarios. So first, you can use the skill if your emotion is not justified by the facts of a situation. For example, let's imagine you're feeling guilty, but then after checking the facts, you realize you didn't do anything wrong or anything against your moral code. So in this case, it would be useful to act opposite to what your guilt is telling you to do. For example, doing something that contradicts the guilt, like making a deliberate effort not to apologize or remain confident. So then you can shift the emotion that way. Second, you can use this skill if the emotion is not effective. So for example, imagine you're really angry at a coworker, but you need to get through a meeting with them and other colleagues. Expressing that anger in the meeting may just not be the most helpful or productive thing to do. So in this scenario, even though your anger might be justified, you could act opposite to it by gently avoiding the person or maintaining a calm, cordial demeanor with them to help the meeting go smoothly. And another key point to remember is you should only use this skill if your goal is to actually change how you're feeling. If your goal is something different, like for example, you actually want to fully express or fully experience that emotion, which is important in some scenarios, then this skill wouldn't be your go-to. So reflecting on your goal in the situation will help guide you on whether or not this skill is appropriate to use. Okay, so I've basically given you some strategies on how to regulate your own emotions. I want to shift gears briefly and talk about how to effectively respond to other people's emotions. So by a show of hands, or I guess not show of hands, but maybe put it in the chat, who has ever been really angry or upset and then someone else told you to calm down? Has that ever happened to people? Yep. See a yes in all capitals? Yeah. Okay, now shift gears a bit. Who found that being told to calm down actually helped them to calm down? Did that help anyone? No? Yeah, I see mostly no's there. And finally, who actually found that it made them more angry or upset to be told to calm down? Yeah. Okay, so I think we've all kind of been there. Telling someone to calm down doesn't actually help them to calm down. And most of us know this intuitively because it feels dismissive or invalidating. So what we know does help to reduce emotional arousal is validation. Validation is basically a way of letting someone know that their feelings make sense given the situation. So it turns out that validation is one of the quickest ways to help another person to regulate their emotions in the moment. And this is why this skill is so important to practice. A few important points to talk about. First, validation doesn't mean that you agree with what the other person is doing, saying, or feeling. It just means that you understand where they are coming from. It's also really important to validate the valid and not the invalid. So this means that you can always validate a person's emotions even without validating their behavior. For example, if a coworker snapped at another team member and said, "I can't deal with these patients right now, someone else has to handle them," you could validate their frustration by saying, "It sounds like you're really at your limit today." So this shows empathy for their feelings without endorsing the negative behavior of snapping or refusing to help a patient. So why does validation matter? Not only can validation decrease emotional arousal, but it also can improve relationships. And this can make teams work a lot more cohesively and better able to meet goals together, like providing good patient care. So how do we actually validate someone? This is a skill that takes a lot of practice and can be applied at different levels. So at the most basic level, you just need to be awake and show interest. So basically you need to be present and engaged with the person. So make eye contact, focus on what they're saying. Don't do things like roll your eyes, sigh heavily, walk away, or change the subject. Second, you can make accurate reflections. So basically this means that you're telling the person what you heard and what emotion they might be feeling. As the person's talking, it can be helpful to observe what the person might be feeling and then search for a word that might describe it. For example, you could say, "I can see that you're angry," or "I understand that you're having a tough time right now." A more sophisticated form of validation is to validate based on the person's history or current circumstances. So this means that you're looking out for how the feelings, thoughts, or actions make sense given what you know about the person and their background or what's going on for them right now. So for example, you could say something like, "I understand why you might be feeling anxious to talk to that patient because last time it didn't go so well." Or you could say, "I understand why you might feel overwhelmed. We're short-staffed and you've been handling a lot lately." And then finally, it can be helpful to put yourself in the person's position. So this can include normalizing the person's experience when appropriate, So for example, letting them know that their reaction is understandable. Like anyone in your shoes would feel stressed. You've been dealing with a lot of challenges. I just want to briefly mention that the same principles of validation can also be applied to yourself. So, self validation basically involves experiencing your own feelings, thoughts, and actions as making sense or understandable in a particular situation. So, you can do this by describing your emotions without judgment. For example, saying to yourself, "It makes sense that I'm feeling nervous right now," or "It's okay to be angry." And one key thing to avoid is using but statements. So you don't want to say to yourself, "It makes sense that I'm feeling nervous right now," followed by "but," and then a bunch of reasons why you actually shouldn't feel nervous. You want to cut yourself off once you notice saying "but." So self-validation can be really, really hard for some people, especially those of us who might be more self-critical. And if it's hard for you, what I would recommend trying is reflecting on what you would say to your best friend or someone who's really close to you if they were in a similar position to yourself, and then applying what you would say to that friend or close person to yourself. Okay, so as I mentioned, validation takes a lot of practice. So to start developing this skill, we'll just do a quick practice activity. So I want you to consider the following situation. Your coworker, who is a nurse on the unit, was responsible for completing patient discharge paperwork by the end of their shift. Due to multiple patient emergencies, they missed the deadline. The next day, you notice they are unusually quiet and seem withdrawn. When you ask how they are feeling, they say they always mess things up. I'm wondering if anyone has any preliminary ideas on how you could validate this person. What is something that you could say to them? Any ideas? And validation's really hard. Okay. So I see one, like, it sounds like you are disappointed with something. What's up? So kind of inquiring, and I see that you've put that label, so of disappointment there. Don't be too hard on yourself. You were busy, so I see that normalizing kind of response. These are some great ideas here in the chat. Sounds like you're feeling really overwhelmed right now. Great. Yeah, so you guys already seem to have a really good kind of handle on validation. But so this slide just kind of highlights a few different ways that you could validate this person from the most basic level to the most sophisticated. So at the most basic level, you can say something like, "I can see that you're upset." So it's not very detailed, but it shows the person that you're listening and aware and attentive towards their emotional state. To get a bit more detailed about their experience, you could reflect their experience back to them, acknowledging their feelings more specifically. So, for example, saying, "It sounds like you're feeling frustrated for not being able to get everything done." So, this shows that you're listening closely and understand their self criticism, making them feel seen and heard. And then at the most sophisticated level, you can tie it back to the person's current circumstances by saying something like, "With all the calls and paperwork you were handling, it's completely understandable that you couldn't get to everything. Most people would feel overwhelmed in that situation." Or you could say, "It makes sense that you're feeling that way. Anyone in your position would feel frustrated. It's a lot to manage. You have so much going on right now. It would be hard not to miss the deadline. It happens to all of us." So both of these more sophisticated responses acknowledges the challenges and then also normalizes the person's experience, helping them to feel less alone. So we probably don't have time to get to this last example, just because I want to make sure we leave time for questions at the end. But here is another one that you could always look over on your own time after this presentation, then maybe reflect on how you could respond. And I just want to close here by emphasizing that validation is really hard, especially when we have our own emotions and stress to manage. And maybe we actually don't really agree with the other person. This can make it really hard to validate. But practicing validation can be really powerful because it helps to reduce emotional strain. It builds stronger team connection and then shows others that we're there to support them, even when we can't change or fix the situation. So I encourage all of you to give it a try and then just kind of see what happens. So that wraps up my presentation for today. I want to say thank you so much for listening and sharing all of your thoughts in the chat. So today we covered some core concepts of emotional intelligence, focusing on strategies to both regulate our own emotions and support other people's emotions. And these skills are really essential, not only for our own personal wellness, but also for preventing burnout, which is a challenge that many of us face in healthcare. And of course, emotional intelligence is a really big topic. And so there's a lot more that we could discuss. So I hope to have the chance to continue this conversation with all of you at some point in the future. But we still have about 5 or so minutes left. So I'd love to open up the floor to any questions or reflections that anyone else has here. Okay, so I see a question. How would you react opposite when all you feel is anxiousness? So actually, anxiousness is quite similar to fear, although anxiousness is a lot more like future oriented. So when we're anxious, we're really focused on like what's going to happen in the future, what's going to happen next. And so actually to act opposite to that, you would want to try and stay grounded in the present moment. So you would be doing activities like mindfulness, deep breathing, things in the current moment that are kind of opposite to like thinking ahead about the future, as well as maybe confronting in a slow and gradual way those things that make you anxious. For example, if it's a certain thing at work or a certain thing at school or whatever it might be, you would want to like confront that fear head on. Hope that kind of clarifies that question. Um, let's see. I think someone asked if there's a replay option. My understanding is this is maybe recorded, so hopefully people can look it up afterwards. And then someone says, how can you recover if you've slipped up and not handled something with high emotional intelligence? I think one, like maybe this self-validation skill that I just shared is really important here, just to recognize for yourself that I think that happens to like everyone. I know at least it's happened to me. And so just being able to have a level of acceptance toward yourself can take that emotional pressure off a little bit so that you can think about what to do next, whether that be like apologize or make a plan of action. I think just recognizing how normal it is to actually slip up and that, uh, yeah, just kind of accept that for yourself, if that makes sense. Um, okay, I don't see any other.
Someone asked in the Q&A if there's any books you'd recommend on the topic, specifically for teens or young adults.
Ooh, great question. Would it be possible to maybe forward those to you after, and then I can just you can maybe distribute them
Yeah,
because
for
nothing
sure.
right now, but I do have some resources I think that could be beneficial for a book. But I'll have to dig it up.
Yeah. Another one was, how do you recover from burnout?
Oh, recover from burnout. Okay. I think there's a few really, I mean, we could do a whole presentation on recovering from burnout. So I'll give a couple like main points. I think one, you need that awareness that you are burnt out because actually a lot of us don't really recognize when we're in a state of burnout. I think the second big skill here is learning to delegate once that happens. So being able to like have a social support network where you can delegate a certain task to take something off of your agenda that you have to do and then make sure to carve out time to then reduce those vulnerability factors. So things like getting enough sleep, getting exercise, eating a balanced diet, treating any physical illness. When you're in a burnt out state, you really need to go back to those basics and reduce those vulnerability factors before thinking about anything more complicated. So I know it might seem kind of simplistic, but those really do set the foundation for emotional intelligence, like we talked about today.